Welcome to this video. I'm getting so many questions about the influenza vaccine, so I thought we'd try and have a go at that. Now, it's an important thing to think about this time of year anyway, and the clear recommendations from the Centres for Disease Control in the United States and Public Health England in the UK are emphatically that older people and at-risk people should be vaccinated against influenza. And the evidence I've found in these studies I'm looking at in this video do support that. They do support that. And it's particularly important this year because if someone has COVID-19 and influenza at the same time, it looks like their chances of dying are 2.7 times higher if they get influenza at the same time as COVID-19. So it's particularly important. Now, there had been some concerns that influenza vaccine reduces people's immunity against other respiratory viruses, and there is some evidence for that. But the evidence we're presenting today shows that it does not appear to be the case for COVID-19, and therefore this reinforces the official guidelines from the Centres for Disease Control and the Public Health England. So that's the bottom line. I can't advise you whether to get it or not. You've got to talk to your doctor, of course. But I'm getting it. I've advised several of my relatives to get it. And yeah. So anyway, let's look at the evidence and a little bit about influenza first of all, just to start us off. So seasonal influenza, we get it every winter in northern hemispheres. And all over the world we get it, and it's caused by influenza virus, and that's a hyperlink. Do look on there, get some more details if you want. Now, this is the public domain picture. I've just taken this from Wikipedia. Here's the credits. Now, the size of these viral particles, so these are the individual viral particles here. So that's one influenza virus. That's another one. That's another one. And these are 10 times smaller than bacterial cells. They're absolutely tiny. So these cells are about 100 nanometers in length, and that's about 1/10 of a micrometer. And of course, there's 1,000 micrometers in a millimeter, and there's 10 millimeters in a centimeter, and there's about 2.5 centimeters in an inch. So we're dealing with this tiny electron microscope scale here, but we do see they are definite separated viral particles. Like COVID-19, they only reproduce inside other living cells. Now, how are we doing so far for influenza? There's not much data in the UK yet, but the Centres for Disease Control put up a weekly update. And so far it's encouraging. And remember, the influenza season in Australia has been the mildest in living memory. So it's looking hopeful for influenza. Now, why do you think the influenza season in Australia, which of course precedes the Northern Hemisphere influenza season, why do you think there's been so few cases in Australia? Well, I think the reason is that the precautions that people are taking against COVID-19 are also protecting against influenza. So it's a win-win situation. I suspect that's what's happening. It could be to do with the virulence or the lack of virulence of the virus as well. So Centres for Disease Control, key update for week 40, ending the 3rd of October 2020, seasonal influenza activity in the United States remains low. Good news so far. UK for the 2021 season, check the reference for yourself. The National Flu Immunisation Programme will be absolutely essential to protecting vulnerable people. Good, I agree with that. And support the resilience of the health and care system. So two problems here. One problem is that, of course, the symptoms of influenza and COVID-19 are very similar, so it can cause a lot of confusion over the diagnosis. But every winter we get people in with flu in A&E departments going into our respiratory wards all the time. And it tends to exacerbate chronic illnesses such as chronic obstructive pulmonary disease, often associated with secondary bacterial infection. Once someone's had a viral infection, they very often get superimposed bacterial infection. and it causes a lot of admissions, and we may not have the reserve hospital bed capacity this winter. So 2 pretty good reasons there. Now, the disease itself, the influenza itself, varies from being a pretty mild disease to being quite a severe illness. I mean, I remember one time I had influenza. It was in this room actually when I used to sleep in here. I managed to crawl up the stairs and I got as far as the door there and couldn't make it into bed. You know, I was so ill. I just lay on the floor for a couple of hours. And I remember thinking, well, I don't care if I die now. I felt so ill with influenza. You can feel really, really bad with influenza sometimes. Other times, of course, it can be fairly mild, depending on the level of immunity that you have to the particular virus and other factors. Now, unlike COVID-19, influenza also affects younger people. Just before we do that, we notice that higher viral loads does make people more sick with influenza. Now, studies have been done on this with influenza. We know that if people have a higher viral load of influenza, they get more severe disease. There's been experimental studies that demonstrate this. And again, all the precautions we're taking, the hygiene, the physical distancing, hopefully the ventilation, the mask wearing, and this is a droplet infection, very similar to SARS coronavirus 2, COVID-19. All these precautions are going to reduce the dose of the virus that we get, therefore hopefully make any influenza less severe. So again, we're in this win-win situation here. We need to keep doing what we're doing in terms of all these preventative strategies. But unlike COVID-19, young people can get quite sick with flu as well. Now, of course, that's a gross generalisation. We know that some young people, tragically, can get very sick with COVID-19. We know it's the vast minority, but with flu, a lot of young children and babies, young children and babies can get quite sick with influenza. So the older more vulnerable, the younger more vulnerable, people with co-morbidities are more vulnerable. So let's see what the Centres for Disease Control is saying. Getting a flu vaccine during the 2021 is more important than ever. Flu vaccine is especially important for children. Children younger than 5 years old, especially those younger than 2 or less, are at high risk of developing serious flu-related complications. CDC recommends an annual flu vaccine for everyone 6 months and older. So another one of the reasons I want to get vaccinated for flu is going to protect me as well, but I'll become some part of the herd immunity, meaning that less children will get influenza because children are prone to getting complications of influenza. So that's an important difference, and one reason we always need to be concerned about the influenza season. Now, annually in the United States, since 2010, it depends very much on the year. You get good influenza years and you get bad influenza years. But 9 to 45 million people get sick every year in the United States. 140 to 810,000 hospitalizations depending on the year. 2009 was a bad year, for example, with the H1N1 pandemic. And 12,000 to 61,000 deaths, again, depending on the particular year. A bit lopsided today. Let's move across a bit. There we are. Right. Now, clinical features in children. Quite a high fever sometimes, as indeed in adults. Quite a high fever. Body aches, which may be severe. Headaches. So achy all over headaches. Very similar, of course, to COVID-19. Bashing the microphone. We're all over the place tonight. Sorry about this. Right, let's get on with it. Sore throat in children and adults. Cough that gets worse. Tiredness, runny and stuffy nose. Nausea, vomiting, diarrhea. Nausea, vomiting, diarrhea. These ones can sometimes, but not always, occur. So, pretty familiar clinical features, really. But possible complications in children are infection down in the air sacs in the lungs, down in the alveoli. That can be caused by the virus, that these air sacs can fill up with inflammatory fluid, or it can be caused by secondary bacterial infection. Clearly, pneumonia is a life-threatening condition. Dehydration, and when children are dehydrated, or anyone's dehydrated, the salts, that's the electrolytes, can be disordered because you need the right amount of sodium, which is a plus, chloride, which is a minus, potassium, which is a plus. And if these get deranged, then the electrolyte balance is a problem. So that's a potential risk in children especially, and anyone, but children especially, because children are smaller, they've got less fluid to lose. Worsening of long-term medical problems, brain dysfunction such as encephalopathy. Thankfully very rare, but it can occur. Now, I've looked after sick children with measles encephalopathy. Again, fairly rare, but it can occur, and a tragic situation with permanent brain injury. Thankfully fairly rare, but can occur. Sinus problems and ear infections are common in rare cases, very rare cases, especially with good medical care. Death. The deaths tend to occur in poorer countries where these things are not medically corrected by good medical care. Now, going on to the initial concern that we had, or a lot of people had, about the influenza vaccine. And I think I can put people's minds at rest about this if you stick around. Increased risk of non-influenza respiratory viruses. So other respiratory viruses other than influenza associated with receipt of the inactivated influenza vaccine. That's the injection normally. So this study here, check it out for yourself. Reputable journal, published in 2012, we were able to observe a statistically significant increased risk of confirmed non-influenza respiratory viruses amongst that's trivalent influenza vaccine recipients. What this is, trivalent, what the people that make these up do is they normally give 2 influenza A vaccines and 1 for influenza B. So there's 3. It actually vaccinates against 3 types of virus: 1 type of influenza A, another type of influenza A, and 1 type of influenza B. So you're covered against 3 strains, basically, or partly covered. So that was the concern. This has been the concern, that it's been known since 2012 that influenza vaccine can make other respiratory viruses more likely. SARS coronavirus 2 is a respiratory virus, so does it make that more likely, is the question. Now, before we answer that, let's just look at this study here from the British Medical Journal. COVID-19, risk of death more than double in people who also had flu, English data show, published in the British Medical Journal. And the odds of dying were 2.27 times higher than in people with SARS coronavirus 2 alone. So, in other words, if someone has influenza and SARS coronavirus 2, they are more than twice as likely, 2.27 times more likely to die than people who only have SARS coronavirus 2. Their odds I'd rather not gamble on, to be quite honest. So we don't want to get influenza and COVID at the same time. And of course, while the influenza vaccine will not protect us against COVID-19, it will protect us against influenza, therefore making it less likely we get influenza and COVID at the same time. This is the key point. Possible synergistic effect in co-infected people. So people that are infected with influenza and SARS coronavirus 2, synergistic effects. And of course, synergistic means 2 plus 2 equals 6 or 7 or 8. It's more than an additive effect. And of course, this is what we don't want. Right, finally, we get on to what's new. What do we now know that indicates that people who have influenza vaccine are not at greater risk of COVID-19 or the complications of COVID-19? And here is this reassuring research. And it's called Safety of Influenza Vaccine During COVID-19, September 20, a Journal of Transitional Science, and it's based in Cleveland Clinics. So it's been accepted by the Journal of Clinical and Transitional Science. Read it for yourself. You can download the full PDF and read it in great detail. Now, the convergence with influenza season could result in significant morbidity and mortality is the background to this study. They recruited from Cleveland lots of patients who tested positive for COVID-19. And they found 4,138 who had the flu vaccine in 2019-2020 flu season. They excluded a lot of people who'd had the vaccine the year before. They just wanted to get the people that had just had the vaccine. And they found 9,082 who had not been vaccinated. In other words, they had a large experimental group who had had the flu vaccine in 2019-2020 winter, and they were able to compare those with 9,802 who had not received the flu vaccine. So they have a very good intervention group who had the flu vaccine and a large control group to compare them against. Now, this study is a bit complicated, try and stick with it, but the group that had been vaccinated had higher BMI, were on more medications, had more comorbidities, were older and sometimes had abnormal blood work. And of course this is what you'd expect, because the people who are prioritised for influenza vaccine are the ones that are the most vulnerable to getting complications, and they are more overweight, on more medications, have more comorbidities and are older. So not surprising that the vaccine group, that is this group here, compared to this group, were more overweight, on more medication, more comorbidities, older and had dodgy blood work compared to the control group, because of the control group, of course, had not been selected for influenza vaccine. They just happened to contract COVID-19 in that winter of 2019 to 2020. So you can see straight away there's going to be difficulties comparing the two groups because of these risks. You're not comparing like with like, it's kind of comparing apples and oranges. And this has been where some of the confusion has come from. So this study involves some pretty clever mathematical statistical tests to account for these difficulties. Let's see what they found. If someone had flu and tested positive for SARS coronavirus 2, just looking at the data, just comparing the groups as they were, vaccinated individuals were less likely to test positive for COVID-19, more likely to be hospitalised, more likely to be admitted to intensive care, more likely to die during hospitalisation. That was unadjusted. But of course, the people that had the flu vaccine were, this group that had the flu vaccine were, as we know, higher BMI, on more meds, had more comorbidities, more heart disease, more chronic lung disease, all that kind of stuff, older and had sometimes abnormal blood results. So it's not surprising that they had more complications because they were in much higher risk groups for influenza, and therefore higher risk groups for COVID-19 as well. So, but once it was statistically adjusted to account for this, all these problems basically disappeared as a result of this statistical, mathematically valid adjustment, making allowances for the high comorbidities in one group and the low comorbidities in the other group. So once it was adjusted, no influenza vaccine was unrelated to the incidence of SARS coronavirus 2 infection, didn't make any difference. Good news. In other words, people that have had influenza vaccine are not, according to this data, more likely to get SARS coronavirus 2, but they are less likely to get SARS coronavirus 2, COVID-19 infection and influenza together, therefore giving them a 2.27 higher chance of dying because they are partly protected from the influenza. So their overall mortality risk is significantly reduced by having the influenza vaccine. Increased risk for worse hospital outcomes was not related to the influenza vaccine. So again, good news. In people with COVID-19, influenza vaccine did not impact on the risk for hospitalisation, did not impact on ICU admission, did not impact on mortality. So there we go. A good study saying that influenza vaccine does not increase the likelihood of developing COVID-19 and does not, if you get COVID-19, does not increase the probability of hospitalisation, intensive care admission or death. But if you do happen to get both at the same time, then your chances of dying are much better. Therefore, it's much more likely you will survive the year if you're in a high risk group, if you are vaccinated against influenza, according to this data. So it sounds good, and the authors agree. So overall, they say influenza vaccine does not increase the incidence of COVID-19, good, or worsen the related morbidity or mortality, good. And they say this provides reassurance that the vaccination strategy for global influenza should proceed as planned during the COVID-19 pandemic. Should proceed as planned during the COVID-19 pandemic. And it's not based on opinion, this is based on data. But because they're scientists, they always hedge their bets a bit. So what they do say was surveillance needs to be prospectively collected in the fall, the autumn of 2020. Prospectively means from now on, looking forward. Obviously, we want to collect more data. And we need to do this to study the outcomes of current SARS coronavirus 2 and influenza infection, which we still don't know much about. We need to know more about that. And we need to assess any interaction between influenza vaccine and a new developed vaccine against SARS coronavirus 2. Not here yet, but it will be necessary to see if there are any interactions between the new vaccine and the old vaccine. We simply don't know because we don't have the vaccine yet. Just to stress, odds of death were so that's you're more than twice as likely, 2.27 times more likely to die if you get influenza than people with SARS coronavirus 2 alone. In other words, influenza and SARS coronavirus 2 is quite a nasty double whammy. We can't vaccinate against SARS coronavirus 2 at the moment because we don't have a vaccine, but we can vaccinate against influenza. Therefore, the Centres for Disease Control and the Public Health England are recommending influenza vaccine in vulnerable groups. So it's just nice to have that data-driven reassurance that the right thing is being done at the moment. So that's all I wanted to say about that. Quite interesting and very reassuring, and of course massive implications for public health. And I know in the UK we're trying to get as many flu vaccines done as we can. In the United States they've ordered millions of more flu vaccines, and that's good. That's good. Right, email of the day. Quite pleased with this one. Right. I showed my primary school building supervisor husband your video featuring the German cross-ventilation study, and he brought it to the attention of the teaching staff. This is where, for a short period of time, they open the windows on both sides of the classroom, get a good through draft, blow out all the contaminated air, reduce the viral load if it's present. Makes a lot of sense. Right, you will be pleased to know that due to your reporting on this matter, well, it's due to the Germans really, but thank you for that, in his school are taking it seriously and have taught the children about its importance. The children themselves are now reminding the teachers when it's time to open the windows fully and get a breeze going, thereby diluting viral load. So yeah, I was quite pleased with that. Excellent. Okay, good. So hopefully you are now equipped with data and evidence that substantiate the policies of the Centres for Disease Control and the Public Health England recommendations on influenza vaccine. Thank you for watching, as always.